Mindfulness-based cognitive therapy combines the science of mindfulness-based stress reduction with cognitive behavioral therapy. The way I explain it is just cognitive behavioral therapy is great and it works, but with chronic pain and trauma, the way the brain changes is it's not able to click save very effectively. The science demonstrated that if they were doing mindfulness-based brain exercises prior to starting the cognitive therapy, and then at the same time as doing the cognitive therapy, the brain was able to click save a lot more effectively and the relapse rates dropped significantly. In a lot of the literature that's out there, they talk about only CBT, and they're forgetting that when you have chronic pain and trauma, the hardware of the brain changes, and so it can be really not only difficult for the brain to click save, but difficult for someone to actually exercise the practice of CBT, because in order to change your thoughts and behavior, you have to be aware of what you're doing and aware of what you're thinking. But because the brain is in that fight or flight mode so much, that self-awareness and that ability to be in the moment is really limited. So it's really hard for someone to do that, and then it feels like a performance issue, and people feel like they're not doing it right or that it's not meant to work for them, as if it takes a certain personality to do the work, and it doesn't. They're just not understanding that their brain just needs plugged in a few places where it's been unplugged. So the mindfulness piece is huge in how it heals the brain, and then we add the cognitive therapy on top of that, and voila.